At least 2 people acquired Zika from mosquitoes that bit them within a 1-square-mile area north of downtown Miami sometime in early July, state and federal health officials said Friday, confirming the first cluster of the virus spread locally in the continental United States. 4 people in South Florida, 2 in Miami-Dade County and 2 in Broward, have been infected by local mosquitoes, according to Florida Gov. Rick Scott, whose announcement triggered a wave of response from public health agencies and elected officials. Florida has become the first state in the nation to have local transmission of the Zika virus, Scott said. Zika's arrival in the continental United States has been anticipated since last fall, following the virus' rapid spread through the Caribbean and Latin America. But confirmation that local mosquitoes have transmitted Zika in Florida set off alarm bells in Congress, with Republicans and Democrats blaming each other for failing to approve emergency funding to respond to the public health threat. The disease also might have major impacts on travel and tourism. Miami is a major port of entry for people traveling from countries and U.S. territories with active Zika transmission, and millions of people are expected to flow through South Florida, on their way to and from the veritable epicenter of the outbreak, Brazil, which is hosting the Summer Olympics. But while the Centers for Disease Control and Prevention has advised expectant mothers and women considering becoming pregnant to avoid travel to areas with ongoing Zika virus transmission, CDC Director Tom Frieden said Friday that the agency is not advising the same for Miami, even for pregnant women, who are at greatest risk from the disease because it can cause microcephaly and other neurological disorders in their newborns. The CDC has advised pregnant women to avoid travel to Puerto Rico and other places with ongoing transmission Zika, he said, because the agency had anticipated an explosive outbreak of the disease on the island due to environmental and other factors. There are likely to be isolated cases in the United States, and there may be occasional clusters in the United States, Frieden said. We do not expect widespread transmission. He said women in the area who are pregnant should consider getting tested for Zika and that they take steps to avoid mosquito bites. However, he warned, if Zika new infections continue to occur in the same Miami neighborhood, even after extensive spraying, inspections and other efforts to reduce mosquitoes, this would be a concern and warrant further advice and action.